I'm delighted to be here with Dr. Kim Cockerham, who's from Northern California in private practice. Really interesting talk that you gave that gave us a lot of tips about maintaining beauty throughout your years. And I'm wondering if you could share some of that information with us.
So the most important thing is that your skin, your hair, your nails, your eyes are all part of your body. So to come to me and expect that a topical product or even a service such as Botox or a surgery is going to help you, it's not the way to go. You really want to start with good nutrition, knowing what your hormonal status is, and considering supplementation if any of those things are out of whack.
So do you help your patients kind of work through how to diagnose themselves with this issue? Do you refer them to a subspecialist, or did you do the testing yourself?
Well, I'm really excited to let you know I'm with a compounding pharmacy now where they do consultations and provide all the testing for the convenience of my patients. I just got really frustrated because a lot of women don't have the right person for this job. A lot of times OBGYNs that's not what they're doing, and a lot of patients have primary care doctors where it's really out of the scope of what they know and what they feel comfortable prescribing.
And one of the interesting facts that you shared with us in your talk was the perimenopausal age group that you're referring to is a little bit younger than I had expected.
So perimenopausal symptoms often start in your early to late 30s. Some women are completely menopausal by 40. Ideally, you don't want to go to zero hormones in your body. Your hair falls out, your eyelashes fall out, your eyelids change, your skin starts to look really ruddy. A lot of times physicians will work you up for like a thyroid disorder, and then when the thyroid tests are normal, they just say, you must be aging. And you don't need to. With correct supplementation, you can really maintain your look and feel really good about how you look for your age.
There was another topic that I found very interesting also in your presentation about collagen rejuvenation. Can you tell us a little bit about that?
So collagen rejuvenation has been around for a long time. We've done it with lasers, done it with heat, things like thermage, but we now know that using just microneedles in a certain fashion can help stimulate the collagen and take care of a lot of different problems. You would be surprised that something that littlely invasive or minimally invasive would help. So the skin pen is an exciting new derma pen, which literally looks like a pen and allows me to treat within a matter of minutes and get amazing outcome, equivalent to the CO2 lasers that I've been using for 2 decades now.
Wow. So this pen, can you just walk us through the treatment and how that would be done?
It's not uncommon that I get referred somebody who, they got on their skin regimen, they got their hormones now under control, and they just want to look fresher. And so with the skin pen, you come in, you have your face numbed. First we clean it, then numb it, and then the treatment literally takes about 10 to 15 minutes. You walk out a little bit pink with some healing makeup over the top of it called Oxygenetics, and within a week or 2, you're already looking rosier. It's more controlled than a peel, it's less invasive than a laser, but it's really fantastic therapy.
And it seems like you can really you can identify the areas you want to treat and really zone in on those.
So one of the common areas is in people that smile a lot would be the laugh lines, the upper lips. A lot of people are drinking out of water bottles, and so that can be really helpful to eliminate those vertical lines.
And you always share with us at this meeting some really good tips about what should be in your beauty bag. And so would you share those with us?
So I have a couple of the products here. I think one of the number one product lines that has evolved over the last 5 years as I've been coming here and talking to you about it is the Blink company. That's Blink with a C. They not only have mascara, but they have brow enhancements, they have eyeliner, they even have eyelash enhancement. And so it's a fantastic product because you don't have to rub your eyes to get the makeup off. You just put warm water and it just comes off as a tube. So it's called tubing your eyelash.
Okay, and what else do you have for us?
Titanium. They're available from a number of different companies. Inexpensive, it's about $40 retail, and it'll last for a year at least. And this zinc is really important in preventing aging, but also preventing skin cancer. Another product that I'd like to talk about is the mask. So a lot of patients have sleep apnea now. You can use the mask to keep the wrinkles off your eyelids, because when we sleep on the side, we end up having a little scrunch on the side of our eye. Or you can use the clear ones with a CPAP machine. So it's really nice to help protect the eyes from the CPAP machine and protect the eyelids from your sheets, basically, and sleeping on them. And the final product I'd like to talk about is this. If you are going in and having microneedling, or you're having Botox or fillers, Arnica Montana is a fantastic product. And it's a capsule, and you just take the capsule starting usually 2 to 3 days before. And it really helps block the bruising and the swelling. So it's a fantastic adjunct to really any therapy.
Well, this has been a very interesting selection of items, and I really want to thank you for sharing this all with us today.
Thanks so much.
Thanks.